Hi guys, welcome back to my channel today. So there were a lot of people who requested me to do a video on which they will understand about pharmacy better, which means what is it about being a pharmacist in Sri Lanka, what are the books that are recommended, and also how you can become a pharmacist in Sri Lanka. So I'm going to talk a detailed view on how you can do all this. I will be answering all your questions. If you are interested, you can pursue in it. Without a further ado, let's get into the video. So what is pharmacy? So many of you think it's just tablets that are scattered around, and we just have to fill it in a particular bottle and give it to the patients. But that's not how it is, because people are always in a wrong impression that it is like that, but it is not. It's not a grocery store, it is not your local store. It's something that is really important for the patients, and it also plays a major role in patients' lives. If you are sick, if you're given a medicine, and who does give it to you is we pharmacists, because there are some things that we need to also understand when we are actually dispensing it to you, when we are filling it for you. So also, prescription is not something that you need to understand what is written in the prescription, because as you know, there are some hospitals yet doctors who write in a prescription, but usually there are doctors who also just print it and give it to you. But yet there are doctors who write it on the prescription and give it to you. So then we have to identify what is that tablet. We have to identify the dose and how it is given, if it's before or after meals. Everything should be written in the labeling. So that is very important. And if certain things, which means if there are any drug interactions or if the dosage is higher for your age, that is, everything is recognized by a pharmacist. So what is pharmacy is that we dispense and also label it for you to ensure the safety of the patient. So this is very important. So now we spoke about what is pharmacy. Now we are going to learn about what is pharmacist. So what do pharmacists do for you? Actually formulate, prepare and dispense to the patients and also to the other healthcare teams. So as you all know, there are other healthcare systems, which is nurses, doctors and others. So they also provide you with what are the other kinds of side effects, also the clinical side of the drug that you are being provided. And to understand that pharmacists also help you to understand with all the devices, with the drugs that are being given to you. They make you understand about the side effects, the effects that it does on your body, and also the contraindications maybe, and also the uses of the drug. You need to understand that we play a vital role in your life, because if you are sick, if we provide you medicines which your doctor prescribes you. So a pharmacist is a most trusted person or most trusted healthcare worker. So we are someone who can save your lives, because it also is a major responsibility, I would say, because if you are prescribed something, it's our duty to give you the right medicines, because if we do a slight mistake in the medicine, it can also change, because there are some medicines that you need to understand which are really harmful to your body. So it's very life threatening, important, and we are responsible that we provide you the right drugs. Also it is very important for us to make your quality of life better, because there are patients who have different types of disease, and they've been provided with medicines for all of that. So what we make sure is to make your quality of life better. And also I would highly say that doctors are nothing without we, because we pharmacists, because we help them with whatever the drugs they give you. So we make sure that everything is in correct order. Maybe the dosage or the interactions are less, or if there is a major interaction, then what can be done. So we make sure that we provide you with everything that is possible from our end. So now we are going to see what is the concept by WHO given to a pharmacist. So there are 7 of them. So let's see what are the key points that was given by the WHO. So there are types of pharmacists that you can become in Sri Lanka, which is diploma, graduate, a bachelor in pharmacy, and also bachelor of science in pharmacy, and also which is the other one is the internal pharmacist. So with this means that you have to go through the government bodies to become a pharmacist, and also you government pharmacies, and also you can work in these NMR, you can work in MSD, you can work in NMQAL. So these are the types that if you become an internal pharmacist that you can work. But if you become an external pharmacist, you can work in the private sectors, and also you can work in abroad as well. Also, I will brief you all down how you can become an internal pharmacist and also external pharmacist. We will be talking about it now. I'm going to talk about the external pharmacist, how it is done, and also about the books, because that was the most requested video or questions that was asked by my followers. So I will be linking about the other videos which I did related to exams, which means the OSPE exams, and also I will be doing the Viva part. I will also add all the links bottom here, and also the types of pharmacist in Sri Lanka. So I will add all of that in the description, so you can. So it's called the Ceylon College External Pharmacist Examination. So pharmacy exams will be done only after 2 years of the course. How many attempts can you make? You can make 5 attempts after your first try, but this will be only done consecutively 5 years. You can't stop in middle. If you do stop, the count will be add on, and you can only do the remaining 4. So if you think that you couldn't do that exam due to any health issues, you should go with a valid medical reason so that you can do that exam. How to become an external pharmacist? You should be 18 years above to be eligible to do this course. You should have done English O-levels and should have done science stream with A-level, and chemistry is a must, and 2 other subjects in science stream. So you should have master pharmacist to train after your 1 year period of course, and this should be done in a 2 year period. So it's always best to choose a master pharmacist in your area so that you can easily go and do it. So if you are a graduate, you can register yourself, or after your A-levels you can register. So how do you register yourself is linked in this description, because everything is online now. So I have done a video on that. I will link everything in this description box. In order to pass the exams, you should do all 3 exams, which is Viva, OSP, and also the written examination. So how is the structure of the exam? It is as written, Viva, OSP, and all of them you should get 100 above 40%. The structure of the MCQ exam is linked in this caption, where I have done a video on it. Candidates should complete the examination. Overall should be average of 50%. Candidates can also apply for recorrection, but you will be charged, and also candidates grades of these will be: A is 70%, B is 60%, C is 50%, D is 40%, E is 30%, F is less than 30%. And also the results will be published in the newspapers, and also it will be displayed at CMC. So I have also added all these links here where you can check of the examinations, and also I will be adding a link of Viva after I do the video very soon. So what are the books recommended? As you can see, I have added everything here. And this is how the class structure will be, where you will be taught all this. So read it for yourself, and I hope this will be useful. So opportunity for a pharmacist is that you can after your pharmacy exams, you will have to be registered at SLMC. You can also apply for Bachelor of Pharmacy degree, which is conducted by Open University. If you're further interested, you can also apply for MPharm, PhD, and also start your own business. Not forget to share also with your friends who are doing the pharmacy exams, maybe this year or coming year. So do let them also know about this video. I hope this video was useful, because a lot of you requested this video, and I know I'm taking it for a long time because I'm stuck with work. So I'm so sorry about it. Please bear with me. I will be doing all your requirements, which means about the pharmacology, pharmaceutics, everything will be done maybe very soon. So stay tuned for that, and do not forget to subscribe, because that's very, very important. And also I'm so thankful for all the love and support which you guys are giving. So keep giving it, and also keep sharing my videos with who it benefits. See you in my next video.